Welcome back. Proper oral hygiene is essential for healthy teeth and gums. This includes daily brushing and flossing. And in addition, you should see your dentist regularly for dental exams and cleaning. Preventative dentistry gives you the best chance for a beautiful smile and long-lasting oral health. To shed more light on the topic of oral hygiene is dentist Dr. Anna Shikwaya. Doctor, good evening and welcome.
Good evening.
Thank you so much for being here.
Okay, thank you for having me here.
To start with, Doctor, talk to us about what the most important daily oral hygiene practices are for, maintaining a healthy mouth.
Okay, the daily one is brushing your teeth twice daily and also flossing once a day, brushing your tongue, and also using antibacterial mouthwash, which can be also substituted with warm salt water. If you are unable to get hold of a mouthwash, you can always use warm salt water because salt got properties of antibacterial, and it also just will be used to wash away all the debris, food debris, and all the plaque that will be stuck on the teeth.
Yeah. So you use warm salt water in the place of your mouthwash if you don't have mouthwash?
If you don't have, yes.
Can you use warm salt water in the place of your toothpaste also? Sometimes you don't have toothpaste, and I know people use salt water to brush their teeth with.
I know. You cannot because with toothpaste, it contains fluoride. And fluoride is very important for like when you are using it to brush your teeth, because it helps to strengthen the enamel, which is the outer layer of the tooth, and also it reverse back. Like if you have a small cavity, it can remineralize these teeth, and it can stop the progression of that cavity to be a little bit bigger.
And what type of toothbrush or toothpaste do you recommend for effective oral hygiene?
Toothbrush, the best one should be the soft bristled one, because it's very soft and delicate on the tooth. Medium, it's a little bit recommended, but hard tooth brush bristled, they are not really recommended because they are very hard on the teeth, and when you are brushing, they will also remove away some of the teeth particles. And the toothpaste, we recommend the smooth one. Like when you look at some toothpaste have sugar kind of like other particles. Those ones are abrasive toothpaste, and those toothpaste, they can also abrase your toothbrush. And when I talk about bristle, I'm referring to these white things.
Right.
And when you buy a toothbrush in the shop, in the box, it's written soft, medium, and hard, and they are referring to that. And if you can see the soft one, they are always expensive, indicating that they are the best, and they are most recommended by dentists.
So you mentioned that you need to use mouthwash in addition to your toothpaste, as well as floss. So talk to us about the importance of flossing.
Flossing, as you can see in between our teeth, like the gaps between our teeth, they are a little bit smaller for the toothbrush to reach that area. So the floss can reach those hard to reach area by the brush, and remove the food that are in between the teeth, whereby you cannot remove them with a toothbrush.
I also know that there's a specific way that you should brush your teeth. A lot of people brush like this, but that's not correct.
No, it's not correct, because most of the people, I brought this to demonstrate, I hope. So the best way, I will do it very fast. The best way to brush your teeth is to place your toothbrush on the outer layer, last tooth in the mouth, and to start doing small circular motion. Small circular motion, make sure that the gum, you touch also the gum, so you remove all the food particles that will be stuck between the tooth and the gum. Then you brush in circular motion, both lower and also upper. Then you open inside, you go inside, then you'll be brushing from inside, like you'll be sweeping, sweeping, and on the last tooth, you'll be like scrubbing. This ensures that all the surface of the tooth is brushed, because sometimes you brush and some area you leave them unbrushed, and those areas will be prone to cavity development because you did not brush them. And also this way of brushing, a lot of people brush like this. This is very wrong, because you create pits here, which we call wedge-shaped defect in dentistry, and they will be develop into cavity, or it will be painful because you expose the underlying tissue like dentin, and it's going to be sensitive and painful.
When it comes to children, what type of toothbrush does one use for them? Do you use toothpaste? Is it necessary? Because a lot of time children's toothpaste is just full of flavor. I don't know if it's got all the things that adult toothpaste has, in such as fluoride, which you mentioned is very important for the teeth. So let's talk about brushing for children.
Yeah, brushing for children is like, you are supposed to start brushing the child as soon as you see like the first tooth in their mouth. That's when you should start brushing. That is around 6 months. So you should start brushing them already. Yeah, they are made with flavor, strawberry, just to attract the kids, because if you put the other one like Aquafresh, they are a little bit bitter, and it will not be acceptable to kids. Yes, they contain fluoride, because it's also an important component, but theirs is a little bit lessened compared to an adult, because too much of fluoride also it causes fluoride toxicity, and if it's used more, like in kids at the age that are under the age of 8 years old, there is a possibility of them developing dental fluorosis, which is like the teeth will have white spot as they are forming, so it's also not recommended. That's why they say when you are like giving the child to brush, like the one that are under the age of 2, you should give them the toothpaste. It should be the size of the grain of the rice. Yeah, and those ones between 3 to 8, it should be a pear size. So just for as long as it's there, and make sure that they also brush, because fluoride is also needed in them. It's only that it's limited, like for kids, they say it's 0.1 milligrams for the younger ones, and the other one is from 0.3 to 0.5 milligrams,
Very important question, this next question. How often should you replace your toothbrush? And at what stage do you know that your toothbrush needs replacing?
Yeah, toothbrush recommended. It's only that we don't like to read, but on the like packet of a toothbrush, it's written 3 months. The toothbrush should be replaced after every 3 months.
Not every 3 years.
No, 3 months. So that means in a year you should have about 4 toothbrushes.
Right.
Yeah, and also you can see, like when you look at your bristle, you can see like they're not up straight like this. The moment you see them going sideways, that already tells you that it's about time for you to replace that toothbrush. I compare the toothbrush to like a broom at home. Yeah, if you look like a broom, you have used it for a long time and you are sweeping the floor, you can see that it's leaving some things behind, then you have to sweep and keep sweeping. It's the same thing with a toothbrush. It's only that unfortunately we cannot see in our mouth, like, I miss this spot. So you'll be like, I did it well, but there are spots that you are missing. So it's better for you to just replace it. And also it's recommended, like if you had an infectious diseases like a cold or fever, it's also recommended for you to change your toothbrush. Yeah, but if you are not able to, many issues, so you can just boil it in hot water and start
using it again. Doctor, what is the recommended time in terms of, or time frame for seeing your dentist in the time span of a year?
The universal way of or universal time of seeing a dentist is after every 6 months, twice a year. But it also depends from a person to a person. There are those people that are prone to dental problems. I can mention people like those ones that are suffering from diabetes. They have oral issues from medication that they consume, and sometimes the hormones also imbalance, like in pregnancy and people. Those people, they can visit a dentist as regular as possible. And also, if they have problems, they can always come to a dentist and just see them, but the recommended time is 6 months, twice a year, which after every 6 months, you should just visit the dentist.
Fantastic. Any final tips, Dr. Shikwaya?
Dentistry is like the most amazing course or most amazing career, and I believe, like I said, oral hygiene is like the basis of dentistry. So we need to take care of our oral hygiene, as we know that also oral health is also linked to the overall body. So if you are not taking care of your oral health, there is a possibility that you can have an infection that carried away to some part of the body, which can cause life-threatening illnesses such as endocarditis, pneumonia, cavernous sinus thrombosis, and other complications that all just start with a toothache. And also we need to take care of our teeth a beautiful smile. And I remember my best friend, Dr. Shikwaya, always tell me that the people that really appreciate teeth are old people. And I asked her, like, why do you say that? It's because it's either they don't have teeth and they wish they had them, or it's because the one that they are having, they are struggling to keep them. Yeah, I really hope we take good care of our oral hygiene.
Thank you so much, Doctor, for being here. Thank you for your time.
Thank you so much for having me.
That was Dr. Anna Shikwaya, dentist, speaking to us. Then we come back, we speak to Cynthia Vaco, who is our Women Crush Wednesday.